I'm a consultant clinical microbiologist and have been for 20 years. Over the years, I've dealt with a number of outbreaks and incidents associated with SARS and then MERS, but also obviously routine infections, and as I say, have done for the last 20 years. And I work for an organisation called Liverpool Clinical Laboratories, which is a large NHS diagnostic laboratory. And we've been integral in terms of our local response for COVID-19, in that we have stood up a service to look for the PCR, to look for the nucleic acid associated with infection. So commonly in the press, that would be called the antigen test in people's nose and throats to say whether they're infected or not infected. But we've also stood up an antibody service as well. So we are testing both patients and staff within the NHS, but staff within the greater NHS family, so care homes, care staff, police, fire brigade, etc., to see whether they actually have antibodies against COVID-19. So we've been doing that for the last 4 months now, and it's obviously ramped up, and LCL has been integral in terms of Cheshire and Merseyside's response to COVID-19.
Now, you mentioned MERS and SARS. How does this particular outbreak, COVID-19, compare with those two?
So I was involved in the Chinese SARS outbreak in 2003. And again, I think there was some quite worrying concerns that, again, that would be a problem, but actually it never really was. It didn't spread like this coronavirus, or it didn't seem to spread like coronavirus. And the MERS virus, which obviously came from the Middle East and Kuwait in the first instance, again, it doesn't seem to have that propensity to spread like this coronavirus does, because it comes from the same family as coronaviridae, but it doesn't seem to have the same propensity. And again, I think one of the big unknown questions is, and unanswered questions is, why is this virus more likely to spread? It seems to have a higher propensity to want to spread. So we put very, very similar things in place for the SARS outbreak in 2003, but it never really came to fruition because we didn't really have that many cases compared with this coronavirus in terms of COVID-19. Scientifically, I don't think we understand exactly why it spreads. There's some theories about it, why it spreads in terms of its mutation, etc., but I don't think anybody fully understands why this seems to be a spreadable organism.
That's interesting. So it's much more spreadable. In terms of how more severe it is, how would you characterize that compared to MERS?
So I think originally the SARS outbreak in 2003 certainly did have some severe cases, but this virus seems to again have a propensity for causing severe disease, especially in certain, as we know, Black, Asian and ethnic groups. It seems to have a propensity to causing more severe disease in those patients who are immunosuppressed, either because they've got diabetes or various other comorbidities. So there's certainly, I think this is probably a more spreadable virus and is probably more severe in the round of things, etc. I would have to say that the vast majority of people, as we know, have a very mild illness and recover completely.
So one of the things I'd like to do is to go through various myths that have popped up around COVID-19. The World Health Organization has produced a list and some sample answers to sort of reasons why there may not be sensible responses that have been experienced in the public. So if I start off with 5G mobile networks, quite a few instances, unfortunately, of 5G communication towers being set on fire. Is there any risk of spreading COVID-19 through 5G technology?
No, and we hear a lot about conspiracy theories and 5G mobile networks, etc. But I think it's absolutely clear to say that COVID cannot spread on radio waves. It doesn't spread on radio waves, and radio waves have no part to play in terms of COVID. And again, people are starting to talk about, or have talked about, 5G mobile network the cause of COVID. But actually we find, as I said right at the beginning, the nucleic acid associated, so the structure, the DNA or the RNA in this situation, carried by people who are infected, and that's got nothing to do with 5G networks. So I can be absolutely clear that 5G networks have nothing to do with COVID, and COVID is an organism that is spread by respiratory droplets, and that's the germ theory. We know that.
Alcohol, any benefits or protection against COVID-19 infection?
No. So again, Gabir, there's no evidence that alcohol protects, and in fact, obviously, higher than usual levels of drinking alcohol can actually have a deleterious effect on people's health. So again, I would suggest that actually people do not go down the route of utilising alcohol as a way of trying to protect themselves against COVID-19.
Antibiotics and bacteria. A lot of people get those two mixed up. COVID-19 is a virus.
So we know that antibiotics and antibacterials have no effect upon viruses, and certainly not against COVID-19. There is some evidence that antivirals and some antivirals may have some activity, and obviously you will be aware of the remdesivir conversation, and there is some evidence that actually that reduces mortality in those patients who have severe COVID-19. The data are a little bit difficult to interpret at the moment because of the way that the structure of the trial was done. Well, it wasn't really a trial, but it was called a simple trial. But actually what we probably need is more data from the discovery trial, which is still ongoing within the EU and in the UK.
In principle, bacteria and virus are fundamentally different things. As a microbiologist, I guess you've looked through microscopes and seen bacteria. Viruses are much smaller. Can you actually see those in a microscope as well?
Well, you can't see COVID-19 in a normal light microscope. You can see them in an electron microscope. But actually, there are very, very few viruses which you can actually see with the light microscope. But in essence, you can't see viruses with the normal light microscope. You have to use the electron microscope.
Thank you. Fundamentally different creatures altogether.
Absolutely. The structure is completely different.
Cold weather and snow.
So again, to my knowledge, there is no evidence whatsoever, and it doesn't really fit with biological plausibility as to why snow or cold weather would actually have a protective effect against the virus and can't kill the virus. To get to the levels that you would need to kill the virus you'd have to take it down to sort of such a low temperature that actually that wouldn't be humanly possible.
Herbal medication has been used throughout the world for centuries. Garlic. If I eat lots of garlic, will that help me protect against COVID-19 or indeed mitigate the symptoms if I have it?
No. So again, there's no evidence that garlic has any effect against COVID-19. What I would say is, and I think there is some good evidence for it, that garlic does have some antibacterial properties, and probably in a limited amount is good for you. You know, Mediterranean diets, etc., full of garlic, and actually is probably protective on the general health. But actually, specifically for COVID, it has no effect whatsoever. There's no evidence whatsoever for it.
Great. We've all been reminded frequently to use alcoholic gel to clean, wash your hands. Hand dryers, some of these hand dryers, can they kill the virus just by themselves?
No. So again, Gabir, there's no evidence that hand dryers can kill the virus. So absolutely, people should be washing their hands or utilising alcohol gel. Washing physically dirty hands is the right thing to do, and drying it with a paper towel or a hand dryer is fine, but it will just dry the hands.
And now I found this next one really quite strange. Holding your breath, will that have any impact on the virus in your body if you have it?
None whatsoever. I know people have said that actually, as a test of whether you've got COVID, if you can hold your breath for a certain period of time, then you don't have COVID. But again, it's just a myth. There is no evidence whatsoever that by holding your breath, you either have protection against COVID-19 or you can tell whether you've got it or not. It just isn't make any sense whatsoever.
Hot climate. I remember one of the, traditionally true, of course, that in the summer we have less outbreaks of flu and cold in here in the UK. But I remember the US president saying that once the hot weather arrives, this was back in March or thereabouts, that the COVID-19 infection would be just killed off by the hot weather. But we all know that people in hot weather countries are not immune from this. And indeed, the Hollywood actor Tom Hanks and his wife were in Australia and they caught it. So hot weather, does that help?
No, so I think hot weather per se and protection against COVID-19, i.e. does it make it disappear? I think that's incorrect. I guess the confounding variable in all this, which is why you go back to flu, is that in the hot weather, in the summer months, people tend to be out a little bit more in the warm weather, outdoors, as opposed to being in houses because it's cold. So consequently, the confounding variable. So actually, yes, respiratory viruses do decrease within the summer, but it's not because of the hot weather. It's because actually most people are out in good ventilation, etc., and therefore you do not see it. But I think we know that the countries that actually do have hot weather are still getting COVID-19, and so therefore we know that COVID-19 and hot weather, they're not mutually exclusive in any way, shape or form.
On the same theme, normally when people do get infected, fever is one of the consequences, and fever raises the body temperature. What about this theory that if you have hot baths frequently, that will essentially put the virus in that environment and kill it off? Any truth in that?
So again, there's no truth whatsoever. So you raise your body temperature very slightly, but the body is a great thing, and obviously has this thing called homeostasis. So if you get into a hot bath, you just cool yourself down in different ways, etc. So you will not get your body temperature up to any point that's going to kill the virus, and to do so would be dangerous. So there's no evidence whatsoever that taking hot baths will protect you against COVID-19.
And likewise with, this might be just a semantic thing as well, hot peppers or hot chilies, if you eat things like jalapenos and maybe very hot curries, would that help protect the body?
No, I'm sure they're very nice and very tasty, but they're not going to help you against COVID-19. So enjoy them while you can, and if you're healthy, enjoy them, but actually not going to protect you against COVID-19.
You've already said that the typical means of infection is through droplets when we're speaking and breathing in and out. Houseflies, is it possible for houseflies to transmit the virus from maybe outside the house to inside the house?
Yeah. So, so at the moment, there is no evidence whatsoever that houseflies or other bugs can cause and can transmit in terms of what we call a vector. There can't be a vector for COVID-19 transmit it. Now, obviously, things can change and that we may get more information, but the current best evidence we have is that actually those vector theories are completely need to be debunked. It is about respiratory droplet spread, and that goes to the heart of actually how we try to mitigate against our risk associated with catching it, and we'll probably come up onto masks and various things a bit later.
Well, in fact, masks is the next topic I'd like to move to. We've heard last night that the government in the UK will be making an announcement that they will become mandatory in shops and other indoor premises. If people do use masks, is there any risk of CO2, carbon dioxide intoxication as a result?
No. So I've seen this and people have said this. There is no risk whatsoever of CO2 intoxication. think masks undoubtedly can be uncomfortable, they're hot, they do feel a little bit claustrophobic sometimes, and I know some people have anxieties about wearing them, but there is no evidence in terms of, even if it's well fitted, this mask, of getting CO2 intoxication, none whatsoever. They may say uncomfortable, but not going to give you CO2 intoxication.
So if I'm jogging or cycling, should I wear a mask?
So probably not. I think if you're exercising, you probably shouldn't wear it, but if you're exercising outside, then the risk of obviously transmitting it to somebody else in a big open space is probably less. So the evidence and the guidance would be that if you're exercising, do not wear a mask.
Great. We've spoken about alcohol. Methanol and ethanol have also been mentioned. I guess the same applies for them too. Yeah,
so there's a whole range of things in terms of methanol and bleach. And so methanol is dangerous. Ethanol obviously is alcohol that we drink, but methanol actually is a frank poison, causes blindness. So we should not be drinking methanol whatsoever. And there is no evidence by the ingestion of alcohol, ethanol, methanol, or bleach that actually you will actually prevent COVID-19. And frankly, it's a dangerous thing to do.
Thank you for including bleach in there, because it did receive some high-profile visibility when the President of the United States mentioned it. We've already mentioned houseflies, mosquitoes as a vector.
So again, there's no evidence whatsoever that mosquitoes can transmit COVID-19. Even in other countries where they have different species of mosquitoes, there's no evidence for mosquitoes as a form of transmission and bloodborne transmission, none whatsoever.
Older people and younger people, how are they? How's the difference in susceptibility for COVID-19 between those two geographical?
So it's a very good question, and I think it's something that needs answering. So generally, we know that older people with comorbidities such as diabetes or heart disease or asthma, etc., have a higher propensity of more severe disease, both for COVID, but also for other respiratory viruses like flu and respiratory syncytial virus. And it's probably a function of both the physical environment that they find themselves in, but also perhaps the immune response, because we know that diabetes has a direct effect against your immune system, and that parts of your immune system don't work as well if you have uncontrolled diabetes. So older people who tend to have comorbidities can get more severe disease. And what we've seen, obviously, through the COVID-19 outbreak, is generally children and young people have a very mild disease, and it may even be subclinical, i.e. people may not even know they've had the disease whatsoever. And so the severe cases tend to be in elderly people with underlying disease, and also obviously in ethnic minorities.
So comorbidities is just other diseases that already exist.
Yeah, so obstructive pulmonary disease, heart disease, asthma, diabetes, all the things that we are saddled with in the West, unfortunately, as we get older.
Great. Pneumonia vaccine, are there any chance that they would be of use for COVID-19?
No, so the pneumonia vaccines, which I think we are talking about against Streptococcus pneumoniae and Haemophilus influenzae, are bacteria. As we said before, COVID is a virus, so they will protect you against the bacterial forms or some bacterial forms of pneumonia, but have no effect whatsoever against COVID. That's not to say that you shouldn't have them. So if you're in the risk group that we've talked about, undoubtedly you should have your pneumococcal vaccine as part of your health check every year with your GP if you fit into that criteria, but it won't protect you against COVID-19.
One of the important things you said right at the outset was the recovery. Now, most people who get COVID-19, this is across the population, about 80% recover without any symptoms. That's a really high number that people just don't tend to usually just forget, frankly.
Yeah, absolutely. And I think most people get better, and the mortality rate of COVID-19 is 1%. Now, that doesn't sound very much, but obviously if a lot of people are getting COVID-19, 1% of that high population is a significant number. But 99% of people who get COVID will survive. It's about a 1% mortality. When we get to seasonal flu, we're talking about a 2% mortality. So it's probably less than seasonal flu. But as you say, most people have a mild to moderate disease and get better.
It's a very important factor there. Thank you. We've spoken about houseflies and mosquitoes. Is it possible to pass on infection through shoes?
So again, what we call omites, which is surfaces which can be contaminated with bacteria and viruses. There's no evidence whatsoever that it could be on shoes. The guidance is that actually perhaps you should be taking your shoes off if you've got young kids around, etc. But I think that's just part of normal hygiene rather than actually specifically for COVID-19. So to be clear, to my knowledge, there's no evidence whatsoever that shoes can carry COVID-19 and be part of that transmission cycle.
Seeing these temperature guns at airports and even train stations, they are just sensors picking temperature up from the individual. Can they in any way kill off the COVID-19 virus?
No. So as you say, the only thing they can do is tell you whether you've got a fever. They don't tell you what's causing the fever. So they may be useful in terms of a screening at airports, which is why they've been put in there to see whether people actually have a fever. But again, categorically, they cannot tell you whether you actually have COVID-19. All they will tell you is whether that person has a fever, and that fever can be caused by numerous either infectious agents or sometimes even non-infectious agents.
Now, I think these thermal scanners use infrared, or possibly, I'm not quite sure, but ultraviolet light sometimes now available on torches you can buy on eBay. Can ultraviolet have any impact on, let's say, instead of washing my hands, if I held my hands under some ultraviolet light, would that kill off the virus?
So it's quite a complicated answer to that. So the ones that you would buy, the UV lights that you buy in your local aquarium or on the eBay, etc., will have no effect whatsoever against COVID-19. There is some evidence, and then so UV light is broken down into UVA, B, and C, and the vast majority of stuff that gets through the Earth's atmosphere is UVA, and UVC actually just it doesn't get through. It's picked up by the ozone or stopped by the ozone. There is some evidence that UVC has activity against COVID-19, but the doses are so big that you'd have to give that actually just utilizing a little bit of ultraviolet light that you might buy on eBay is going to have no effect whatsoever on COVID-19. So from a hospital point of view, there is some interest in terms of whether we could look at UVC as a way of disinfecting surfaces or even the environment, etc. But it's at a very early stage, and the dosing is so big at the moment that actually it's probably not practical to do so. So in essence, UV light should not be utilized as a way of trying to disinfect or to cure yourself from COVID-19, because it will not work.
And of course, even if you could get something that would offer UVC, the intensities required might cause other damage if you were to.
Absolutely. So certainly UVC has a very short wavelength and is very high energy and will disrupt your DNA the human, so you shouldn't be utilizing it on yourself, because actually you will cause yourself damage.
The antibodies, this is from the King's College study, antibodies are not long lasting. So that would mean that if I got COVID, recovered, I could get it again.
Potentially. So antibodies are just one part of the immune system, and they may not be the most important part for giving you immunity to COVID. And again, this is a bit of speculation on my part. I don't really understand completely how the immunology and the immunity works with COVID. So antibodies is one bit of it, and that's what we're looking at when we look for the antibody tests and see whether people have been exposed to it. But what we don't know is whether, excuse me, whether they're the right type of antibody, and they for a considerable period of time. The King study would suggest that the antibodies decrease quite quickly, but there's other parts of the immune system, as I say, called memory T cells, which might be useful in terms of saying your body will say, I've seen this virus before, and then it can mount an immune response. So we don't really understand all the scientific around the immune system and coronavirus.
But you have come across people who, have you come across people who have contracted and suffered from it, recovered and contracted COVID-19 again? That's not unusual.
It's very unusual, but I certainly haven't got that experience as to whether we've truly seen people who have had it, got better, had antibodies, and then got it again.
I do accept that this is some speculation on your part, because we are in something that none of us have experienced firsthand before. How do you think this COVID-19 infection pandemic is going to end?
So there's the million-dollar question. So I guess most people are putting their money on a vaccine and development of a vaccine. And as you're probably aware, there are a significant number of vaccines in trial and in development. I think the problem with it at the moment is actually we don't understand the immunology and the immunity well enough. So even this week, there's been two slightly diametrically opposed pieces of work published. One from King suggesting that antibodies are in COVID infection are very short-lived and may not offer long-lasting protection, which is slightly concerning, I suppose. And that's surprising given the fact that most seasonal coronaviruses, because coronaviruses have been around for a long time and they cause colds and a bit of respiratory disease. And we know that the antibodies that we raise against those are not long-lasting. But there's also been a study looking at another part of the immune system called memory T cells, and they seem to be hanging around and actually allow some protection against COVID-19 moving forward. So again, the million-dollar question is to say, what immunogens, what parts of the virus provide a response, an immune response, which actually then can be long-lasting. So if we can get a vaccine which causes long-lasting immunity in the population, then actually we could get to a position where everybody could potentially be vaccinated and we get herd immunity, and we would actually have long-lasting immunity. We don't understand that at the moment, and as you're probably aware, there's probably two candidate vaccines in the UK at the moment, one from Imperial College and one from Oxford. We've been doing some work with the Oxford vaccine in Liverpool and getting people enrolled in the trial. And it's only when I think that trial publishes will we know whether the vaccine route is the way forward in terms of trying to control the outbreak and to contain it. In the meantime, what we probably just need to do is ensure that we're all sensible in terms of social distancing. We wash our hands when they're physically dirty with soap and water and dry them. When they're not physically dirty, you can use alcohol hand gel. And then when we can't socially distance, probably utilising a face covering or a mask is certainly as we come out of lockdown and we're going back into shops, going back into restaurants, etc., then probably a face mask is the right thing to do.
Dr. James Anson, consultant microbiologist and medical director for Liverpool Clinical Laboratories. Thank you very much for your expertise, and thank you for all the work you and your colleagues are doing in this very unusual times. Appreciate it very much indeed. Thank you.
No problem. Thank you. Thanks.